Hi, I am so delighted to meet you in the program of 1 minute please. Why thiamine is badly required in chronic alcoholic patient? Why thiamine is supposed to be given before administering glucose containing IV fluids? You are all aware that chronic alcoholic patients are at increased risk of developing thiamine deficiency because of poor intake and poor intestinal absorption, and of course there is a rapid elimination from the body. So what is the role of thiamine in our body? Thiamine acts as coenzyme in the form of thiamine pyrophosphate, which actively participates in the metabolism of carbohydrate, fat and protein. When glucose enters the cell, glucose is converted into pyruvate. Then subsequently pyruvate enters into TCA cycle and pyruvate is converted into energy molecules that are called ATP. So this conversion of pyruvate into ATP occurs with the help of TCA cycle. But TCA cycle enzymes or enzymes that are involved in the TCA cycles requires thiamine in the form of thiamine pyrophosphate as coenzyme. In the absence of thiamine, what happens? TCA cycle is interrupted. So in the presence of thiamine deficiency, glucose can be converted up to pyruvate only. From pyruvate to ATP conversion, that is called the TCA cycle, which requires thiamine very badly, doesn't occur in the presence of thiamine deficiency. So what happened? So in the presence of thiamine deficiency, glucose will be converted into pyruvate, then pyruvate can't be converted into ATP anymore. So all the pyruvate is getting diverted into formation of lactate. So when lactate accumulation is more, then cells are getting damaged. One. And second, how thiamine supports another pathway that's called pentose pathway or HMP-sen pathway. So what is the benefits that are offered by pentose pathway physiologically? So pentose pathway offers ribonucleotide. This ribonucleotide are the backbone of DNA and RNA formation. And second, this pentose pathway produces NADPH, which is essential for fatty acid synthesis. Third, pentose pathway produces many intermediate molecules which protects our cells from damage induced by reactive oxygen species. Then pentose pathway helps in production of ribonucleotide. So in the presence of thiamine deficiency, what happened? Pentose pathway also is getting interrupted. So there is no ribonucleotide formation. So DNA, RNA formation is affected. There is no fatty acid production. And third one, so there is no immune from this reactive oxygen species. So because of all these reasons, thiamine deficiency causes extensive cell damage, especially mammillary bodies and thalamus and hypothalamus in our brain, resulting in ophthalmoplegia and ataxia and peripheral neuropathy, collectively called Wernicke's encephalopathy. That's the reason if you infuse simply only glucose without thiamine, so what happened? Glucose will be converted up to pyruvate. Unfortunately, pyruvate can't be converted into ATP molecules and your HMP-sen pathway also affected. Because of all these reasons, before you administer glucose containing IV fluids in all chronic alcoholic patients, IV thiamine 100 mg intravenously for at least 3 to 5 days is very essential. Thank you.